All right. Okay. Good job. Okay. Right. Making sure we are covered. Hey guys. Oh, all right. We're going to do this tonight. Hey, getting on here, doing this live. Tonight, we're going to talk about how to start a home care agency in the state of Virginia. This is actually a great state to start a home care agency, and I would love to help you guys with it. Thank you so much for joining. Thank you so much for joining. So, first, just want to introduce myself or reintroduce myself. Hey, everybody, I am Sean, aka the Savvy Business Chick, making sure that you know your person destiny in the marketplace. And I am here to help you, whether you are a home care professional or healthcare professional. That is my RNs, my LPNs, my CNAs, my HNAs, my direct support workers, or if you are not a healthcare professional. Hey, Nurse T, how are you? If you are someone that has worked at a home care agency, you've worked in the back office of a home care agency, or maybe you had a family member who needed home care. Maybe you were a family caregiver, and hey, Minty, you were a family caregiver and you hired a home care agency and you grew frustrated with how they provided the service to your loved one, and you're like, you know what, I can do this better. I just want you to know that I love Virginia because Virginia is, to me, a very easy state to start a home care agency. And as you guys know or may not know, I am in the DMV. So that stands for DC, Maryland, and Virginia. And so Maryland right now is a great state to start a home care agency as well. Oops, had a little blurb. Maryland is a great state to start a home care agency, but it's such a long wait in Maryland. Maryland right now has a long wait, meaning they're going to take about 9 months just to even review your application. And sometimes people contact me and they're like, Sean, I don't mind waiting. I'll wait for that. So then if that is you and you can stand to wait, then, then Maryland may be your place. But if you are in the DMV and you, hey, and you don't want to wait, then I want to let you guys know all of the wonderful things about Virginia, which I have enjoyed helping over 23 home care CEOs start um, agency here in the state of Virginia. And some have started non-medical home care agencies, and some have started medical or skilled home care agencies. And I'm going to break those both down so that you understand. So usually when I go through how to start a home care agency and I go by the state, some of the things I'm going to share with you guys is how to go through the application. Yes, I'm going to give you the ins and outs of how to go through the application. Hey, I am a home care business mentor and I actually help people with their licensing process. But let's say if you want to do this on your own, this is how I would advise you to do it, right? Now, I always tell people, can you start a home care agency on your own? Yes, you can. It may take you longer. You may go through some blurps, some challenges because we don't know everything. And especially when we get to the policies and procedures, that is one of the most challenging parts of starting a home care business, is understanding how to write these darn policies. And anyone that may be on here that has worked with me, they may say, yeah, I wouldn't have been able to do that. I wouldn't have been able to write a quality assurance program. I wouldn't have been able to write a policy on how someone could file, how a client could file a complaint. So That's what we're going to go over tonight. And if this is your first time watching me live, thank you so much. And please don't make this your last time. Start by following me and turning on your notifications. First, because I will go live randomly on you, number one. And then secondly, I am always sharing tips and tricks in my Instagram stories. I am a little bit more active on Instagram than any other platform. It's usually like Instagram, then it's TikTok, then it's LinkedIn, Facebook. I'm also on Threads and Pinterest, and of course YouTube. So I am on different platforms, and so you can find free content of how to start or grow your home care business. But we all know that the secret is when you get me one-on-one, or if you join my home care mentorship program. So we'll talk a little bit more about that later, but you're more than welcome. Tonight we're going to talk about Virginia. Now, if this is your first time watching me, please drop the number 1 in the comments. If this is your first time joining me on a live, please drop the number 1 in the comments. And then also let me know where you are watching me from. And then we're going to get into how you can start a home care organization in the state of Virginia. So I'll wait for that because I want to see how the delay is. If it's your first time watching me, give me the number 1, and also let me know where you are located. Yay! Hey, Ohio, thanks so much. And we do help with how to start a home care agency in Ohio. I just helped someone. That took about 3.5 months. It took a little bit longer. This is your second time. Hey, Maryland, how are you? I've been getting a lot of calls from Maryland, and so we might have a boot camp. Hey, Ohio. I actually have a free training on Ohio too. So if this is your first time watching me, I have a free training on Ohio. It's either on my YouTube channel, or it's if you click the link in the bio. So just like this, where I'm going through how to start a home care agency in Virginia, I did that with so many states. I did that with Maryland. So for those of you who are watching, I have a free training on Maryland. I have a free training on California. I have a free training on Tennessee. I have a free training on Connecticut. I have a free training on Ohio. Actually did Virginia a while back, but for some reason I have no idea where that training is. So that's why I'm doing it again. And I've gotten so many calls on Virginia recently. I also have done Georgia in the past. I can't seem to find that training, so I'm going to do that again. We're going to be doing Minnesota soon. We're going to be doing Arizona soon. We're going to be doing Mississippi soon. You'll be surprised. We're getting calls from a lot of people who want to start home care agencies all over the U.S. Oh, and we're going to be doing Texas again soon. Yes, so we're going to be doing Texas again soon. But tonight, let's get into Virginia. Like I said, it's one of my favorite states, and it's relatively easy once you get past the main requirements. So first and foremost, the licensing fee for Virginia is $500. So that's how much it will cost you to get licensed in the state of Virginia. Now, that is definitely not high when it comes to other states like Oregon. I know I just picked a random one. $2,500 if you want to be a non-medical home care agency. California, $5,600 if you want to be a non-medical home care agency. Illinois, $1,500. Florida, $1,700. So we do have some states that will be less than $500, but when it comes to that, you can if you pay $500, you could be either a non-medical or a medical home care agency. I feel like this is a good application fee. So that's the first thing. You will just put that amount aside. for your application fee, you're going to need to, of course, register your business. So some people come to me and they say, well, how should I register my business? Can I be a sole proprietor? No. Now, I'm not here to give you tax advice or exact advice on your business structure, but most people who are starting a home care agency, they're either starting as an LLC or an INC. Now, an LLC is typically what people choose. And I can just tell you from my tax person that after you start bringing in a certain amount of revenue, most people will change to an INC because you kind of get double tax with the LLC. Once you reach over like a $50,000, you know, uh, revenue or a profitability level. Again, I am not here to give you tax advice. I'm just sharing what my tax person shared with me. I'm actually going to try to have him talk to you guys or talk to my mentees so that you can position yourself uh, to initially to pick the right corporate structure. So you are going to register your business with the state of Virginia. You're going to get your EIN number, which is free from the IRS. Then if you have an LLC, then you're going to list your governing body. If you have an INC, you're going to list your board of directors. Yes, they want to see who is on your governing body and your board of directors. So your board of directors, that's like your CEO, your COO, your CFO. Your governing body, that's like your president, your vice president, your treasurer, and your secretary. They want to see who is on that list, and they actually want to see that you had an initial board meeting about the startup of your business. This is actually one of the things that you would have to submit in the state of Virginia with your initial application. You will have to submit board meeting minutes. When someone works with me, I give them a template. I just say, hey, fill this out. And then that fulfills that requirement. Because some people are like, how do I write board meeting minutes? Well, I've made it a little bit easy for you so that this can be in compliance with the application. Now, 2, you're going to need to choose an administrator. Now, thankfully, unlike some states, like say, for example, like Illinois, you don't need to be a registered nurse to be an administrator, or you don't need to be a physician to be an administrator. So you can you can have various backgrounds. Now, they prefer someone that's had like a public health or home health or some kind of health related experience, but you do not need to be one of those to start to be an administrator. So you would submit the administrator's resume as well as your job description. Now, usually if I have an administrator that I know that is a non-health professional, what I do is I say, hey, let's cater your job description to reflect that you don't have to be an RN to be an administrator. That way it's in compliance with how they're going to view that administrator's qualifications. Next, so if you are going to start a skilled home care agency in the state of Virginia, then you would need to have a director of nursing, and you would need to submit your director of nursing's job description as well as his or her resume and license number. Now, even though Virginia participates in a compact state, it is preferred that person have a Virginia license. Now, I do have people who have submitted like a license for like from Maryland. Definitely it couldn't be from DC because DC is not a part of the compact state, but for them to, accept it with the license. Then you want to have, there is a policy that you would submit initially, and that's called your client's rights policy. I'm going to go over what that covers. Right now, I'm just going over the checklist. Now, this is a checklist I normally give to some of my mentees when they're first when we're getting ready to getting prepped for them to submit their application. So, evidence of office occupancy. Thankfully, in the state of Virginia, you do not need to have an office space. These are great advantages because some states want you to have an office space. Again, I said I'm in the DMV, so Virginia and Maryland, you do not need to have an office space. You can actually start um, with a home office, but DC is going to make you have an office space. Florida is going to make you have an office space. There are other states that want you to have an office space, or they'll make you validate that you have the proper zoning to be able to operate a business in a residential area. So evidence of office occupancy, usually that's something like a lease. You would need a lease agreement. Again, I usually give, if we don't do that for one of our mentees in our licensing program, usually we would give someone like a template. Here is a template of how you would have a lease agreement between the agency and the landlord. Same way, if you were to have a office building, you would have a lease agreement. There was another form. They don't necessarily require it. That has to do with the zoning. So actually, I won't bother with that. So they will sometimes ask you for a zoning clearance. It is not required, it's just recommended. Then here is something that is a little bit different for Virginia that a lot of other states do not ask for, is that they do want you to submit a business plan and operational budget with your license. Now, your business plan, usually if someone is in my home care licensing program, we will do their business plan for them. That will include the counties that they want to cover for the state of Virginia. Your budget, if you were doing a budget, you would do an initial startup budget, which you're starting with, like your salaries, that you will pay your RN supervisor. Oh, I mentioned the director of nursing. That's more so for a medical or skilled home care agency in Virginia. If you were doing the non-skilled, you would just need to have an RN supervisor. Now, you would need to have both on your license. Both the administrator and the RN supervisor are key people that they want to know about. Okay. Copy of your business plan and budget. Now, then Virginia also makes you submit insurances initially with your home care application. The 3 insurances that you will need in the state of Virginia is you need to have a professional liability insurance policy that is up to 2.4 million per occurrence. Of course, that doesn't mean that you're paying 2.4 million, but just think about if you have an auto policy for your car. Like, so let's say, for example, if you have a G-Wagon, right? And the value of that G-Wagon, let's say, for example, is $185,000, then they're going to want you to have coverage that will cover up to a G-Wagon. You couldn't just have like $75,000 coverage. So you may not pay $185,000, but you would have to get a policy that covers up to that amount. So that's what they mean by up to 2.4 million occurrence per the regulations. So that will be your minimum. And so usually you would either get something like 2.5 or 3 million for your professional liability policy. And the tricky thing about Virginia, unfortunately, is that their coverage amounts can increase every year. And that is what made Virginia a little bit pricey to get your insurances. So that would be like the most disadvantage for this state, is when you are obtaining your insurances for this particular license. Your next one is you would need to have a general liability insurance policy that covers up to 1 million per occurrence. And then you would need to have a third party crime insurance, which is also called like a fidelity bond, that covers a minimum of 50,000. So those are the three insurances. And then lastly, you have a copy of your emergency preparedness plan. Now, emergency preparedness plan, that covers things like, what if there was a fire and you had to evacuate with your client slash patient? What if there was a tornado? What if there was power outages? What if there was a flooding? Just different. And there are other states that require this policy, emergency preparedness, and some of them call it just environmental emergency policies. So this is pretty standard for, in my opinion, states that are pretty serious about how they want to protect the consumer, which will be your seniors, your special needs or your medically fragile peds, and then also your disabled individuals. So everything that I just covered right there will be considered Part A. And if you're like, what do you mean Part A? So there are about 15 things that you would submit initially with the first part of your application. And we're not even done yet. We're not even done yet. Because then you have to get to your actual policies and procedures. I know you're like, but you just mentioned the client's rights policy. You just mentioned the emergency preparedness plan, but we're not even done yet. So I want to stop right here and ask you guys if you have any questions before we move forward. Any questions? Any questions? Because remember, this is an informational video, so this is designed to help you with getting licensed. And I'm going to show you this is a part of the application. You have a question? I'm going to show you a part of the application, guys. This is a part of the application. Remember, I was saying you would put the names and titles of the governing body. You would put, you have emergency preparedness plan, you have your malpractice insurance, and they're listing the code that that goes with, okay, and your job description, your resume. So that is Part A. Show you one more thing. Oops. Let's see, that is the initial license fee, $500. It renews every year. It's $500. Moment. I feel like this application is pretty easy to complete. It's only 5 pages. I just want to show you guys another part of the application. Okay, so this is when we would put your services. So if you were just doing a non-medical, you would only put personal care. But if you were doing medical or skilled, you can put skilled nursing care and personal care. Um, you can also offer respiratory therapist services, physical therapy services, occupational services, speech therapy. So, Virginia, when they say, um, you know, medical or skilled agency, they will really allow you to provide the different, as they say, disciplines or levels of services. They will ask you, I can't show you this part of the application because I just filled it out for one of my mentees, for your license number of your administrator, if your administrator is a nurse, and for your RN supervisor. Um, Another thing that I'm going to answer your question in just a second, I'm not ignoring you. You can have all other branches, which means if you started, say, for example, in like Northern Virginia, and then, hey, the agency is growing and we want to open up another office, then they will just ask you to list where this office is located so that mostly so that they can have like a field supervisor to be able to go to that area. When you are become a licensed home care agency, you do open yourself up to unannounced inspections, and that's why they'll ask you what are your hours of operation, right? And then they'll ask you who is your administrator. That's like, to them, that's your contact person. Now they do not, and I say do not do an unannounced visit prior to you get licensed. So when you're going through the licensing process, you have part A, we're going to get to part B, and then um, basically you're kind of safe from having an unannounced visit or survey. The what usually triggers is you're on a roster or on a lottery to be selected to have an unannounced visit, or you get a complaint that reaches the state level and they have to come out and inspect you. I'm going to answer your question. Just show two more things on the application. So your geographical areas, you can list your geographical areas here, and they will allow you to do 1, 2, 3, 4, 5, about 10 areas. And then that's when, uh, if you did a branch, let's say for example you were in Northern Virginia, and then you decided to do a branch in like Richmond area, then you can add on additional counties based upon that branch location. Remember, I talked about doing your business structure. So they're going to ask you what's your business type, corporation, partnership, so proprietor. Um, they have some church organizations that starts home care agencies, and then they have some public or county. So this will be your area over here. You will be a for-profit agency, and you would either do corporation or LLC. Remember, I don't advise the sole proprietor because that generally means that you cannot hire someone under. Yes, I am answering questions. Please post your question in the comment. You cannot hire someone to work underneath you. So I don't advise that. So again, this is a 5-page application. There are some states where the application is like 24 pages long. It's a very, very long. So let me answer a couple of quick questions, and we're going to get to part B. So I was asked, how long does it take for the licensing process? So from start to finish, let's say, for example, if you were to submit your application on August the 15th, Usually they will review your application within about 45 to 60 days. The whole application process usually takes between 3 to 6 months. Remember, we have part A and then we have part B. So I'll give you an example. One of my last mentees that she submitted her application. She actually submitted it in November. Was it November or the end of October? She got licensed by the end of January. And what she would have been licensed sooner, but they are gonna, when you get to part B, they require you to have a criminal background clearance that has to be done at their offices, and you have to schedule an appointment, and they did not have any appointments available. So her and her husband, they both started together, had to wait. So, and we're going to cover that a little bit more when we get to part B. So that answers the question. How long does it take? How long does the licensing process take? I would say roughly between 3 to 6 months from now. Remember, 3 to 6 months from you submitting your application. DC, okay, so you're asking about DC. DC is a little bit longer. DC is about 6 to 9 months because DC just changed its licensing program. Okay, great question. What if you start as a non-medical home care agency in the state of Virginia? Because we're talking about Virginia tonight. Can you switch over to a medical or skill agency later? Yes, you can. Yes, you can. And that's why that I actually advise that. And that's why when you start off as your um, initial license, right? When you renew, usually when you're renewing your application, your home care license, this is the time where you would kind of switch over. Now, you would have to notify them because now you would need to submit new policies that go along with that level of agency. You would need to submit they would need to review your RN supervisor if you're using a different one. And then you would need to submit skilled policies. But great question. Oh, you're more than welcome. Yep, I'm doing this so that you guys can just have a better understanding of how to start an agency in the state of Virginia. And some people, you guys are waiting to talk to me. Um, um, right now, my calendar is booked out until October. I do have a waiting list, but here is something you can think about while you're waiting to jump on a free call with me. You know that I offer a free call initially for you to talk to me and figure out what you want to do. Like I said, I really like Virginia, so this is a good state, and I'm going to be completely transparent with you. The only thing that kind of sucks about Virginia is the insurances, because it's kind of like you can't control that some of the policies are a little bit high. So when you say, "Hi, Sean," what do you mean? Let me see if I can pull up one. Like, I know one of my recent mentees were submitting his application for Part B by Monday. Is we are going. He got, I think, his professional liability policy ends up being like 147 a month. Now, when you're not even licensed yet, that can start to add up. But guess what? You have to do that in order for them to approve you. So some states don't require that you have a license right away, or they'll ask you for it when you get to Part B. But also the good part about it is because they know they have requested that you have these have initiated these insurance policies. They're going to move right away. One of the things that I like to do Just about every time when we start working in a new state, it's call their licensing department. Well, Sean, why would you call their license department if you just worked with them last month or 3 months ago? Well, one of the reasons why, a very great example, is that I have a mentee. She started in February for in the state of Illinois, and we submitted her application, and she got licensed within like 3.5 months. Someone started 30 days afterwards, just literally 30 days afterwards, or either we submitted her application 30 days afterwards. And now she has to wait to October to get her review. Now, I want you to be familiar with this word. It's called survey. Most of the time, if you are in a regulated state, you are going to need to have a survey. Consider a survey like a pre-interview. And what they're doing is that they're interviewing you to make sure you're in compliance. And instead of using a resume and a job description, they're using the regulations and your policies to see if you're in compliance. And if something is not in compliance, they can say, hey, I want you to change this, or we can't approve you because this is not in compliance. This is not up to code. This is not up to standard. If you have a really nice surveyor, they'll give you some time to update that. But they will clearly put on their application, this is non-refundable. This fee is non-refundable. So they will give you secretly about three chances to get it right. And so that's when I said at the beginning, can you do this on your own? Yes, but you're gonna, to avoid costly mistakes, to avoid it taking longer, you might as well get the help. Sometimes you can do some parts of your application on your own, but you should definitely get the help when it comes to the policies and procedures. Okay. Okay, you guys are asking me about other states. How do you feel about starting a home care agency in Lake Capital? Is the OTL on standby right now because of Philadelphia? A quick answer, yes. You can start there. Start outside of Philadelphia. Great. That's definitely a great idea. You're more than welcome. Hey, Carmen. How are you? You were asking, Gouillard, you were asking me about another state, and we're talking about Virginia. Yeah. And I will share information, questions like that. Feel free to DM me. A lot of times I might answer that better in my stories. If you guys like really follow me, check my stories. I'm always giving little tips of different ways you can navigate through situations. So I would check my stories daily, so you can maybe have some answers to some questions that you may not even have thought of. I may share something from my from one of my mentees that they just went through, that we just helped them with, that can help you. DC is not as easy, to be honest with you. DC, I would say the best word, how like they would say relationship status is complicated. DC makes you go through a whole bunch of hoops, right? Yes, I do help with getting approval with OTL. I have a training for that that includes 3 one-on-one Zooms. So, all right, now let me go. I'm going to go to part B. But before I go to part B, I want to share something fun with you about the state of Virginia. Now, there are a couple of there are a couple of cities that if you start there, just hold my finger. If you start there, you will have great success in your home care business. Okay. So Alexandria, Arlington, Centerville, Chesapeake, Dale City, Hampton, Lynchburg, Newport News, Norfolk, Portsmouth, Richmond, Roanoke, Suffolk, Virginia Beach. Okay? Those are that doesn't mean that if you are in another city that you will not be, hey, how are you? That you will not be as successful. It just means that according to senior statistics, and you guys, like, again, if you follow me, you know I share statistics. According to senior statistics, these particular cities have a greater chance. You're going to have a larger population of seniors, and not only a larger population of seniors, but a larger population of seniors who would need in-home care. Earlier today, I was talking to an LPN who wanted to start a home care agency in Mississippi, and um, I chose we picked one city, which was Jackson, Mississippi. In Jackson, Mississippi, there are 19,000 seniors in that city, right? 19,000. So I said, okay, let's drop that down to 9,000, right? So out of those 9,000, let's drop that down even further to 5,000. So let's say it was 19,000. Let's say 10,000 don't even need home care because they're active seniors. You know how we got these seniors that are going to the gym, that are active, that are keeping themselves healthy, they're drinking their beet juice. They're active seniors, right? So let's say 10,000 out of that 19,000 are active seniors and they don't need home care, okay? According to the census, 19,000 seniors live in that city. Okay, so out of that 9,000, let's drop another 4,000. Let's say four of those remaining 9,000 have a family member that's going to take care of them, right? So now we're left with 5,000 seniors. Do you know how many agencies were in the city of Jackson? 25. She was so surprised that only 25 home care agencies existed. Do you believe that 25 home care agencies can take care of 5,000 seniors? Most likely, there are probably, uh, let's say, I'm going to do a percentage. It's probably like 500 seniors that are not being cared for. So that, therefore, you have what's called, you guys ever heard of SWOT? You ever heard of the acronym SWOT? SWOT stands for strengths, weaknesses, opportunities, and threats. So there was plenty of opportunity there in Jackson. And so then when I'm telling you about these cities in Virginia that have, that were highlighted with high senior statistics, strengths. So this is how you evaluate. What is, you can say, what are my strengths or what is the strengths? Okay, the strengths is that this city has a lot of seniors. Weaknesses is that, okay, maybe most of the seniors are on Medicaid. So I will be able to get paid, but the reimbursement will be low. Opportunity is that it's only 25 agencies here in this area that's serving them. Threats, that there is a smaller pool of caregivers. So you would use all four to problem solve and be able to market and navigate your business so that you can be profitable. So those were the cities that, and I'll say them again: Alexandria, Arlington, Centerville, Chesapeake, Dale City, Hampton, Lynchburg, Newport News, Norfolk, Portsmouth, Suffolk, Virginia Beach. So that's about 12 cities out of so many cities that were highlighted as really, really great cities to start a home care agency in. And I'm just going to pick one and give you guys a little bit more information before we go on over to part B. So I'm going to pick, should I pick Centerville, Richmond? Should I pick Arlington, Centerville, or Richmond? Which one should I pick, guys, to give you guys a little bit more information? Make sure. Come on, you guys talking to me? Which one should I pick? Richmond, hometown. Okay. So thank you for answering me. Okay. All right. So 11% of the population in Richmond are seniors. 37% of those seniors live alone. That's good, right? So we got to ask ourselves, why are they living alone? Like, they could be widowed. They could be, they have adult children that live outside of the area. What if their adult children lived in Northern Virginia, right? That's like 2.5 hours away, right? Then it says that compared to other states, Virginia is ranked 12th for long-term care. And so that 12, which means that's a pretty high number, meaning that it's a lot of people that could need long-term care. And then, this is good. 20% of the seniors that live in Richmond are veterans. Okay, so then we'll be looking into VA programs, our disabled veterans. This is some really good statistics, right? Now, again, if you guys have never joined one of my lives, you may not know. Well, Sean goes over statistics. Yes, this is how we plan. This is how we know we're making a good business decision for, make a good business decision and how we're going to make some money, right? Okay, so here in Richmond, so then we got to ask ourselves, can the seniors in Richmond afford our services, right? And so I'm going to show you guys this grid. Look, it says the annual income for seniors, right? Look, there are about 2,500 seniors that generate anywhere between $50,000 to $75,000. Now, this is fixed income, right? Then we have about 1,100 seniors that have a fixed income between $75K and $100K. Then we have a little bit under 1,000 that have a fixed income of $100K to $150K. And they're not too far behind, a little bit under 1,000 that have $150K on up. That's good, right? That's good. This is good. Now let me show you something else. Because you're probably wondering, hey, thanks for joining. You're probably wondering, I'll try to do Roanoke well, how much do I? Okay, so you're saying I can make some money here. Okay. Sean, show me how I can make some money here in Virginia. All right. So, okay, so, okay, look. In the Richmond area, the average in-home care cost for a homemaker or home health aide is $27.50. Now this means this is what people are already paying for their home care, right? Right? So we're going to use that, but I'm going to, I didn't mean to press that. I'm going to lower it to 26, right? So I'm going to do even lower than the medium. So remember, we just saw that there were a lot of seniors who had a fixed income of 100K and above and 150K and above, right? Of course, a greater amount was in 50K to 75K. Now, this is fixed income. I'm going to be out of town, Hypeness. Or I'm going to be out of town. I do want to go with you. Oh, that's for that conference. Oh, yeah, because Nurse Sonia told me she wanted to meet up with me too. She's going to be there. Sorry, guys. My friend was asking me a question. One moment. Let me show you guys this. Where did I do my calculator? Okay, here it is. Okay, so guys, I'm going to give you a equation, a scenario of I'm going to use $26 an hour, right? I'm going to go below. Reason why I like going below is because I want you guys to see how easy it would be for you to make your first six figures, right? We're going to say, let's say $26 an hour. Let's say this client only wants 6 hours a day. So $26 an hour times 6. That's $156 a day, 5 days a week. That's $780 a week. That is $31.20 a month. One client. This is revenue. This is revenue, right? So we're going to say we have 5 clients like this. So times 5, that's 15,600. Now we know that if we have a case that is just a 6-hour day case, guess what? We have one caregiver working that case. So we got 5 clients, we got 5 caregivers. Very, very low overhead at this point. 15,600 a month for 5 clients times 12. We're already at $187,200 in revenue in a year with 5 clients. I've already hit 6 figures, right? That's revenue. Now let's say how much are the caregivers in Richmond making? I'm going to go over to Indeed, and I'm going to find out how much are the caregivers making. Now remember, people are paying $27.50. That was a medium. That means there's some people paying more, and there's some people, billing more, and there's some people doing less, right? So, because I want you guys to see, I'm not just making these numbers up, okay? So I'm going to go with the first one just because I don't want to take too much time. So between $12 and $14 an hour, this company is paying, right? So again, I'm going to go with the high. Okay, so let's say we pay them $14 an hour times 6 hours a day. That's $84 a day, 5 days a week. That's $420 a week, and that is times 4 weeks, $16.80 a month. Now we were generating $3,120 in revenue from the one client. So if I minus how much we are paying our worker at $16.80, then your spread or your difference is the $14.40, right? So we multiply that times 5 clients. So instead of your revenue is the 15,600, your profitability is the 7,200, right? So again, that's for 5 clients. And then if I multiply that times 12, then your profit is 86,400. 5 clients. You didn't do anything. You did not go work that case. You put someone else on that case. And then even if we were to minus, because we know with Virginia, you can have a home office. So you can start with a home office. Even if we were to minus out the cost of, I'm going to go back to the 3120. That's how much you bill, right? Then I'm going to minus the 1680, right? Then let's say, for example, you decide to pay, so the difference is $14.40. Let's say you pay yourself. Now, granted, you are supposed to leave money in your account so you can grow your business. So you would not take this whole $14.40. What you could take would be, let's say, for example, because right now you want to increase your profitability. So let's say, for example, you took this and you spent $150 a month extra on your marketing. Then you spent let's say $375 on your insurances. Let's say your insurances, right? Because the insurance is kind of high there, right? And then let's say you paid yourself $500. $500 may not seem like a lot right now. And you did, right now you have a difference of $415. And you did, what else could you pay for? We're just going to minus maybe another $50. So then you got $365. So at this point, after if you were to put that $500 back into your office, you would have more. But right now you only have about, as far as your profitability, not your revenue. Let me go back to this. Is about $5,000 to $6,000 at the end of the year that you did not touch. Now that I would use for a cushion for my payroll, that I would use. But remember, I only use 6 hours a day. So you could get a case that's 8 hours a day. You can get a case that's 12 hours a day. And if you use that same system, guess what? You're going to have more revenue with that same 5 clients. I just chose to use 6 hours because sometimes when you first get started, you get a client that's 4 hours a day. Sometimes you might get a client that's 12 hours a day. So you could get a different variation. So this is just an example of how much revenue you could potentially make with just 5 clients and 5 caregivers. And someone asked me today, should I quit my job to, just run my home care agency? Well, you could literally do this still working for someone else. Because everybody, I would not advise to quit your job right away because you're not ready yet. You are not ready yet. So I would not advise you to do that. So that is, now let me get to this other part of, I'll quickly do a little bit of statistics for Roanoke, but I do want to get into part B. Roanoke, 14% of the population of Roanoke are seniors. 38% of those seniors live alone. 23%. So jumps up a little bit higher of the seniors in Roanoke are veterans. So yes, my stats. Yes, Natasha. They are veterans, right? Now there is a way to be able to service veterans. You have to get credentialed with the VA. You got to get credentialed with the VA. Now the VA will not contract with you if you're not an existing home care agency. So I always say step one is getting licensed, or actually step one is registering your business. Step two is getting licensed. Step three might be Medicaid. Well, step three should just be marketing, period. You need to get your first clients. You don't need to be waiting for Medicaid or the VA. So actually step three is marketing. Step four is either you choose to start with Medicaid or you go with the VA. For Virginia, good news, and good news. Most of my mentees who have gotten credentialed in Virginia, it has taken them. They have became Medicaid providers in Virginia within like 60 days. Very great news. It's a very easy process. That's why I say I like a lot of things about Virginia. They don't make it as complicated as like, unfortunately, Maryland and DC. But sometimes you have to remember, if it's this complicated, that must mean it's, they got some goodies, right? That's how you have to look at it. You got to always look at it from a positive perspective. So, so real quick, just finishing up now. For Roanoke, we don't have a lot of seniors in Roanoke who have large fixed incomes like we saw in Richmond. So we have about a little bit over 1,400 that have a fixed income of 50 to 75,000. Then not as much, 500 who have a fixed income of 75K to 100. 336 from this, 100K to 150K, and then another 300, 150K on up. Now remember, hi, how are you? We are doing Virginia, and I actually will be redoing Georgia. I've done Georgia before, but I won't be able to mix my statistics just to keep this video clean. But thanks for asking. So for so if you take 1485, that's how many seniors. 1485 plus 512, that's how many seniors made 75 to 100K, plus 336, that's 100K to 150K, and then 315. That's 2,648, right? Now you saw how I showed you how much you can make low six figures with 5 clients. So you have a potential of 2,600 clients who can afford your services. Then if you say, you know what, all I need is 20 clients, I'll be at 800,000. all I need is 50 clients. I'll be at 7 figures. Oh, thank you so much. So that's how you have to plan it out. All right, so let me get to the last parts. Put this up. Close some of these windows. Anybody else have any questions? Now, when we get to part B of the Virginia licensing process, you do have to have a good amount of policies and procedures. And again, this is no surprise to me because this is the standard if you are in a regulated space. No, you do not need an office space. You can actually start with a home office. Again, another great feature of Virginia. You can start with a home office. So when you get into your policies and procedures, they're going to ask you for policies on your personnel. That's anywhere from how you're going to screen your potential workers to how you're going to train them, if that training matches the curriculum and the requirements by the state. Then giving them a criminal background check. So when I mention personnel usually covers several sections, right? And then you would have to send over a sample employee orientation packet. This is all a part of part B. Then they want to have you write a HIPAA or confidentiality policy. That's pretty standard. Clients' rights policy, we talked about that before. Infection control practices and measures. Okay, those are policies on hand washing guidelines. How often your caregivers should be washing their hands. How would we back when COVID was more robust, was more rampant, we have policies on how to do COVID screenings. So that would fall underneath infection control. Something as simple as changing bed linen to manage infection control will be a part of a policy. Food safety, cultural awareness, clients' complaints. How would you verify if you have a skilled home care agency? How will you verify the license of one of your staff? Your client's rights policy and quality assurance. Quality assurance is usually, has to do with, managing if there were incidents in the home. How would you pick up that there's been a trend? If your staff needs training, how would you know if your clients are satisfied with the delivery of the service? Then they also want to see how are you doing your service plan, or for a skilled agency, how are you doing your plan of care? So there's about I would say 5 sections. Let me see if I can pull this up. Policy procedures. The sections that we normally cover, actually it's 7 sections that we normally cover when we assist someone with writing their policies and procedures. Is 1, organization administration. We will help you with those governing body policies. That's where the state is looking for, well, who is in control? What's your organizational chart? How are they managed? And how is your agency staying in compliance? Your scope of services, that has to do with your admissions criteria. Are you making sure that you don't discriminate when you're admitting someone? And how would you notify them if you had to discharge them? that's what that pretty much covers. I'm just quickly going through the sections, and also gives you a description of the services. Um, then your actual client care has to do with how you would do an initial assessment, how you would readmit clients. Let's say, for example, if someone went to the hospital and or they were in rehab for a long time, how would you readmit client? How would you orient a worker to a client? Your service agreement policies. What if there was a death in the home? How would you manage if you had doctor's orders? Um, Discharging and termination, and of course your client rights, um, handling medical emergencies. What if you had a client that had a do not resuscitate order, client elder abuse, child abuse and neglect? How will you manage the privacy of your client records, communicating with people who have a disability? Oh, thank you so much, Dr. T. Um, uh, and that section is pretty long. This is why I always say you could do it, as they say, you could do it all by yourself, but it might take you a little bit longer. And guess what? We're only on section 3. Then your HR or your personnel, again, that's your recruiting, your background checks, how you would train your staff to report elder abuse or child abuse, your job descriptions, orientation, your training, curriculums, um, their code of conduct, and then how would you deal with their pay, like their salary, and then of course we provide a employee handbook. Health and safety has to do with, remember I was telling you about those environmental emergencies, um, ensuring home safety. A lot of slips and falls can happen in the home, because there hasn't been safety checks. What to do. So we still do have our COVID policies there, and that covers the infection control section, um, of the policy. And handling an incident. An incident is if someone fell, and it doesn't necessarily have to be, the fault of your worker. It could just be, that you have a client that's prone to falling. And food safety is just a new financial management. How we help you with how you would come up with your service rates, how you would inform your clients of their financial responsibility, how you would do your payroll and your billing. And then lastly, we have policies for how you would review your client records, how you would regularly check them for, we call them quarterly activity reports, to make sure that you have a good quality program that goes along with the quality assurance program, how you will monitor and evaluate that. Those are the kind of policies that they are looking for. And you're more than welcome. Those are the kind of, hey Maureen, how are you? Those are the kind of policies you're looking for. And that is what you would submit in part B. And remember, part B is like your interview. So they have their regulations, and they're looking to see keywords, right? So let's imagine if they have their regulations and they're like, okay, she said that keyword. Okay, got it. This one is good. All right. So then you have this one. Okay, I see that keyword here. Okay, so we're gonna approve this one. And so then that's kind of like how they go about doing things. For me too. My mentorship program usually is a 6-month licensing. I have a 6-month licensing program. Again, remember, it's going to take about 3 to 6 months for you to get licensed. Usually, we have pretty much a great track record that we can get you licensed faster than the time they put on the website. Why? Because remember I said one of the first things we do is we contact the state and we kind of get a feel. Hey, how busy you guys? How many applications do you have? You know, are things moving fast or are you guys slowing down? So we get a feel. So then by our second Zoom session, because we do a lot of one-on-one Zoom sessions, we are able to let you know, hey, yeah, you should still be able to get licensed by the end of the year. They're going moving through things pretty quickly, and so we start working on your application and requirements right away. We start with the business plan because that has to be developed, and that might take the longest. So your business plan includes your service area. So I did like a surface research, um, and you guys probably thought, oh, those statistics were awesome, but I will go have my market researcher go break down the counties that you're going to serve. What are those numbers looking like? The numbers are how many seniors, but then I also ask them how many seniors, um, like the exact number, have an income of 75,000 or up. Then we identify how many veterans are disabled, um, that are this age, like age 65 and up. And then what are the chronic conditions in this area? This not only helps with the business plan, but it helps with our marketing campaign. So with my home care licensing program, it's a 6-month mentorship program that takes you through completing your license. We do it together because you guys saw there's a renewal period, right? And you need to know how to do this on your own. So many people pay someone to do it for them, but then when it comes to the getting relicensed, they don't know how to do it on their own. And there's some parts of the application that can kind of come across as really intimidating or complicated. So we help you to do, we work with you to complete your application. And then after that, uh, we submit the first part, then we start working on your policies and procedures. We go through the policies and procedures with you so you can understand, and you kind of are getting training as an administrator during that time. You understand what the policies, you understand the regulations, and you will know how to answer certain questions if the state asks you during like a survey. So there are 2 one-on-one Zoom sessions a month. You also get automatically enrolled into my home care CEO mentorship program. Now, that's usually designed for someone who is already licensed, but what happens is that a lot of my pre-approved mentees, they like hearing how other agencies are doing things, and it's helped them to change their perspective. It's helped to motivate them, because people come in, they're dropping success stories. Hey, Sean, I after we did that training, I went to go do this, and I got 2 client referrals. Or some of them, they may say, hey, I'm still struggling with this. Okay, now let's address it for everyone. So it's a great network, and we meet anywhere from 2 to 3 times a month as a group. We're actually going to have a group training tomorrow on how to market your home care business to these independent living facilities. So we have certain subjects that we cover that help you with targeting your ideal client or customer so that you can grow your business. So that's how my home care mentorship program works. You could jump on a call with me, or after this session, you can send me your email, DM me your email, and I can send you over the fact sheet that includes what's covered in each of the modules, and then what is how much that program is right now. And it is a one-on-one mentorship, and then you do have some sessions as a group. So you have that time with me that you can ask some questions about starting your home care business, or and to include customizing your home care business so that you can maybe even develop a niche. Because, oh, I forgot to mention, we also will develop some of your marketing material for you. We do your brochures and your flyers and your social media templates, and we also help you with web content. So hopefully that answered you guys' question. And I just wanted to get on here and, as I say, drop some gems on starting a home care agency in Virginia. And it's pretty easy, even though I went through several sections and you might feel like, oh my gosh, that is a lot. It's a lot if you don't have help. It's a lot if you don't understand what you're doing. And so that's why I do advise you to, at some point, get some kind of mentorship or assistance with completing your application. All right. So if anybody doesn't have any, make sure anybody has any questions. And if you don't have any questions, we're going to jump off. Questions going once. Questions going twice. Oh, you trying to type it? Okay. And this video is going to stay up probably 24 hours, and then I'm going to, oh, thank you so much for the badge. I'm going to put it on in my portal, so that you can have access to yes, I do. You can have access to the regulations and the application. Oh, okay. Hey, oh, yep, I can't wait either. I'm excited. Let me see. Thank you so much. Can you start in home in Maryland also? Yes. Great question. Maryland and Virginia have similar requirements. The business plan, you can start with a home office. Only thing that makes Virginia a little bit more advantage, yes, I do assist with marketing. The home care licensing program includes marketing. You can ask one of my mentees, I don't think she's up here anymore. She got her first client with less than 45 days. Right? So just a little backstory. I am not a nurse. I've never been a nurse, and I never did any bedside care. So my background is I went to American University here in the DMV, and I studied international business. And during that time, I grew a love for marketing. So marketing is really something that I enjoy doing. And I just so happen to be blessed where I can help others with understanding how they can better operate, market their business. So I was just on a call earlier today with one of my mentees who got a 24-hour case from a facility. And she's been so focused on this case and she's doing a great job with it. I said, okay, so now I want you to go back there and market. And she was like, what? And I just literally broke down what she's going to do, what kind of marketing material she's going to use, what she's going to say. And so she can get more cases like that, because that 124-hour case is bringing in $16,800 a month, one case. So you remember, guys, I gave you an example of 5 different cases, five different cases and 5 caregivers, right? But like really in home care, you can get so many variations of, okay, this client only wants 4 hours. Okay, how am I going to do this? This client wants 12 hours. And this is what really changes your profitability. Hey, Jess, how are you? This is what really changes your profitability because 16,800, right? And for home health. So that's how much she's generating from that case. So 16,800. If she got 5 more cases like that, that's the goal. That's why I'm trying to send her back, right? That's $84,000 a month. So at 5, she has 5 people working on that 124-hour case. So that means she would have 25 workers. You're still kind of like low overhead. So you're still kind of low overhead. And even if we boosted it up to, I got 25 people in the field, but then I have 3 people maybe working in the office, right? 2 are full-time, 1 is part-time. So so right now we're just talking about the income. Revenue. Let me not confuse you guys too much. 84,000 a month times 12. She gets 4 more clients like this. She'll hit 7 figures in 12 months. It's just a little bit over $1 million. Sometimes it does not take a lot of clients, and that's what I would say my home care mentor taught me a lot, but there were some things she definitely did miss out in sharing with me, so that when she passed on and then I got another mentor who had more of a financial background, I was able to understand, oh, this is how some of the larger home care agencies are doing it. They're just tracking the billable hours. So the billable hours could be different per client. So if you think about it, that one client that has 24 hours, that's technically like 3 clients in one. Because if we were to break their shift up to 3 8 hour shifts, then that's technically like 3 clients in one. But we have 5 people working on that one case, so it's a little bit easy to manage a case versus them in multiple locations. So it becomes a little bit easier to manage these cases. And then when you build in systems and efficiencies, then you really your business can run a lot more smooth, efficient, where you don't have to work. And I highlight that, where you don't have to work, because as I've been saying since I did this summit recently, how are you going to boss up if you're at the bedside? And that's for my nurses, my healthcare professionals that still have a somewhat of a secret love of doing bedside care. You can't really boss up if you're always at the bedside, if you're filling in. No, you do that by growing your business, because the money that I shared before, even if it was only, even if you were only paying yourself $500, that's $500 you did not have to work for. Best areas. I have a video on TikTok for that. And I'm sorry, I'm definitely not trying to be rude. Thank you so much for the badge. I'm definitely not trying to be rude. I'm sharing this with people who are in Virginia, so I just wanted to keep that video clean. But I definitely have a video on TikTok that goes over the best areas in Georgia to open up an agency. And I've definitely helped people with a skilled and non-skilled in Georgia, and with marketing as well. So I really appreciate you guys jumping on this live with me. Sorry if it was a little bit long. I just want to make sure that I explain this very, very well so that you can make the best decision for yourself. If you are thinking about starting a home care agency in the state of Virginia, it's very easy, and whether it's skilled or non-skilled. Long term, would you choose Virginia or Maryland? Mm, that's kind of tough. Virginia, I'm starting to feel a little bit like Maryland is a little crowded, even though I'm the main one that will tell you, um, don't be intimidated by, oh, it's so many agencies. And I was talking to one of my newer mentees. She is starting an agency in Texas, and she didn't want to start an agency in PA because she was like, it's so many. And then she said, well, you know what? I have a daycare, and it's a lot of daycares around here, and I still have a waiting list of people who want to get into my her daycare. So I was like, that's the same perspective of how you got to look at starting a home care agency. That don't look, you might think it's so many home care agencies out here, but they're not servicing everyone. And yeah, they're not servicing everyone, and so I would not be intimidated with competition. So Maryland or Virginia. Mm. Right now, I'm kind of feeling Virginia a little bit more, just because of how easy it is. But you said long term. Mm, I'm still going to go with Virginia right now, even though I've been asked to help a couple of people in Maryland recently. I'm still going to go with Virginia right now. Still going to go with Virginia right now. Now, guess what? That might change with this new governor. That's a tough decision. You asked me a hard question. A great question, but a hard question. All right. Well, thank you so much, guys. And I appreciate you joining in. And I'll be saving this. This will be up for 24 hours. If you're just tuning in, you want to see it from the beginning. And then it will go to the link in my bio so that it can include some other forms that go along with getting licensed in the state. Have a good night. Bye.